Hello everyone, you are all welcome to lecture number 1225, and today's topic is premature death due to mouth, or we call it oral cancer. And why I have taken this topic? Because nowadays globally more than 300 people, they are suffering from mouth cancer, more especially in India, Bangladesh, Nepal, Sri Lanka, many Southeast Asian countries, including Papua New Guinea. They are suffering from very common mouth cancer, that is called lip cancer, and oral cavity cancer. And according to statistical data, I have gone through some of the research papers. Why such an alarming situation is there? And nowadays, lot of youth in the age group of 30-35, they are getting mouth cancer. Previously, a few decades ago, the cancer was only for elderly people, only after the age of 50 or 60, people used to get cancer. But today, it is becoming very common in young generation because of their lifestyle. And what it is mentioned in all those statistical data, three factors are very risky factor to have oral or mouth cancer. First is use of tobacco in any form, either in the form of cigarette or in the form of kola nut or betel nut. We call in India Delhi. In Nigeria it is called kola nut, pan, and that is cigarette smoking, tobacco chewing, and also smoke of the tobacco inhaling. So these are all very common factor nowadays. Because of that, the youth, they are suffering from mouth cancer. So that is one factor which is highly linked to tobacco use. The second factor is alcohol. Alcohol is also very strong link to have oral cancer, mouth cancer. It is all statistical data and it is on the basis of evidence. This data is given. And third factor is, that is obesity, overweight. In America, Europe and other prosperous countries, nowadays youth, they are overweight because of some lifestyle, sedentary lifestyle. They are not going for gaming. They are just sitting and watching TV or playing with their smartphone. So in that condition, extra weight is added. That is also one of the factor and indicator that they are having oral or mouth cancer. And for decreasing the risk factor of mouth cancer, we have to take some steps. First, we have to maintain our weight, that is reduce the overweight. Also stop all this smoking, tobacco use. These factors, they are very important factors. And also do exercise, live in the atmosphere where oxygen is there, enough oxygen, keep away from stress and strain. Also those who are using coffee, that is also one factor of reducing the risk of oral cancer. And you know what is cancer cell or cancer? Our body is having normal cells and they are working normally. Why one cell becomes abnormal and they are performing abnormal functions is sometimes genetic factor is involved, sometimes nutritional deficiency is involved, And once I say lifestyle is involved, means that you are living in overcrowded area where you are not getting enough oxygen, because once you are getting enough oxygen, you are doing exercise, you are in good space environment. Oxygen, if you are having enough oxygen in oxygenated atmosphere, once the cancerous cells are formed, they cannot survive for long period. Secondly, if I say your good lifestyle means eating pattern, if you are taking normal food, especially if you have the tendency of cancer growth, stop milk, stop sugar, stop starchy vegetables, go for root vegetable. And why? Because once you are taking all those food items, they are contributing the acidic condition of your body. And in acidic condition, your cancer cell will multiply very fast. So these are all preventive measures we have to take, that is eating habit. And also, once you are irritated, you are having lot of mental noise, that is also one of the factor to develop the acidic condition, more acidic condition in your stomach, intestine, and because of that, your the cells will become slowly abnormal, and they will be turned into cancer cell. And once there is cavity formation, or there is something irritating to your lip or to your tongue or to your gum, any part of the mouth, you will get cancer. So these are all very, very important factors. And in India nowadays, it is alarming because this youth oral cancer or mouth cancer is causing lot of economic problem. Latest survey indicates that 0.81%, almost 1% GDP is involved. Because of mouth cancer, India is losing 1% of its GDP economy. It's a very serious condition. And it is premature death. Youngsters are dying. And once anybody who is diagnosed with mouth cancer, their maximum time limit of survival goes from 1 year to 5 years. Within that period, he or she will die. And the second factor is social factor. Once you have mouth cancer, your lip is involved, your tongue is involved, your throat, back, all face, everything is involved, your gum is involved, and you will be D-shaped. Sometimes the oncology surgeon, they have to cut some portion of your face, of your lip or your jaw or so many other things. So your look will be quite abnormal, and it is frustrating and depressing. So that trauma is also there, that socially you will be depressed because your outlook will be abnormal. So these are all factors we have to take care. And one thing is very clear, anybody who is going to have cancer or who is suffering cancer means his immune system is completely compromised or his immune system failed. Because in our body, we have fighting forces. That is T cells, fighting cells, white blood cells. So if any abnormal bacteria, virus enters in our body, they will knock down. And if they are not knocking down, means in our body, we are having lot of free radicals. And we are suffering from that is called oxidative stress. Once we are suffering from oxidative stress, means it is towards cancer development. There is high risk of cancers once we have this condition where you are not getting enough nutritional, I can say, food which can reduce the oxidative stress. So we have to take care our lifestyle. Most important fruit are colored fruit or vegetable. They are very rich source of antioxidants. There are some minerals. They are very important source of antioxidant like zinc, like chromium, like that. So we have to go for selective diet, lifestyle, enough sleeping, reduce tension, stress and strain, avoid bad habits of alcohol, of chewing the tobacco, of smoking the tobacco, of inhaling the tobacco, chewing the kola nut, chewing the betel nut, pan masala. So many masalas are there in India, Bangladesh. And that's why this reason, Bangladesh, India, Sri Lanka, India, all these areas, they are chewing lot of pan masala, pan and betel nut. That is very strong factor. And these are all factors, what I am discussing, I have gone through lot of research papers and statistical data is published. And all from every country, they are linking that tobacco is the first condition which is making irritation. Anywhere there is irritation, there is chance of abnormal cell growth, tumor cell growth. And some people who keep mustache and beard, and sometimes those beard hair, they are always irritating the lip. That's why people, some of the males, they get that type of, that is called lip cancer. Some who are keeping lot of betel nut pieces inside mouth, or where there is cavity formation, it is stuck. There is irritation, and because of that irritation, there is chance of development of oral cavity cancer. So your lifestyle, your disciplined life plays very important role. This is the one image of oral, or we call it mouth cancer, where you see the tongue inside the mouth is having wound and bulging, lot of deformation. And once this condition comes and it is not possible to recover for months, then you go for the test and it indicates that you have got mouth cancer. This is lip cancer, is also part of mouth cancer. And you can see the spot, bloody spot, always leaking up the blood from the lip. And you see that he is having mustache and beard. And all these beard hair, they are irritating the lip upper surface. And that is also, it is mentioned in statistical data, that wherever there is chance of irritation to any part of your body, it triggers and there is high risk of cancer. And that's why there is lip cancer is also part of oral cancer or mouth cancer. This is called very common in youth. All those two also common. Is called oral, that is cavity cancer. So oral cavity cancer means if there is formation of cavity in your teeth anywhere and for long, and always it is irritated because some of the food is, or even the tobacco or the pieces of betel nut is stuck, and slowly it will develop the cancerous growth, and then it will be serious condition. So please take care of your oral cavity, I mean that is teeth cavity. If there is decay or some problem, always visit the medical personnel, dentist, and get it filled or clean, or even if it is serious, whatever doctor advice, you follow that one. So here summary is given. Number one, cancer is very common disease in the world, and 2/3 oral or mouth cancer is found in India. And due to this, there is a huge economic loss and emotional stress in family members. Number 2, oral or mouth cancer costs roughly 0.81% of GDP of India. It is very serious concern. Indian GDP is almost 1%. There is loss is because of premature death of the youth due to mouth cancer. It is very serious concern, and as we know, 95% of mouth cancer is caused by tobacco, cigarette, smoking, betel nut chewing, or any type of nut chewing. Here in Nigeria, it is kola nut. Lot of consumption of alcohol in India, Bangladesh, Sri Lanka, that area, that is called lot of pan masala using that in Bangladesh. That's why Bangladesh position is third in the world, that is in Asia. Number 3, the cancer appearing in the part of oral cavity like lips, tongue, cheeks, floor of the mouth, gum, or in the back of the throat, that is hypoflexin and oroflexin, larynxins. All these areas collectively are called as oral cancer. The lip and oral cavity cancer is the most common cancer in the world, and 37 million people are suffering globally from these two type of cancer, that is lip and oral cavity cancer. Number 4, increasing risk factor. They are meant to increasing risk factor. First is overweight, obesity. Anybody who is overweight, obese, is high risk. He can get diabetes, he can get blood pressure, he can get cancer. So obesity, you have to control the weight. This is very, very important. And nowadays in European countries, Western countries, child obesity, youth obesity is a serious concern because of variety of junk food, fast food in restaurant, mall, and there is no calculation of calorie intake and out burn of the calorie is the serious issue. So that is being overweight, obesity increases the risk of mouth cancer. Number 2, consuming alcohol, tobacco, increasing the risk of mouth cancer. And number 5, decreasing risk factor. What are the decreasing risk factor if you are taking? Consuming non-starchy material, stopping the milk, stop the sugar, stop the refined product, stop red meat. So these are the decreasing risk factor of mouth cancer. Number 2, choosing healthy dietary pattern, sugar, milk, stop it, and go for more colored fruit and vegetable which are rich source of antioxidants. Avoid junk food and refined food. Number 3, consuming coffee might decrease the risk of mouth cancer. These are all indicators. Now in one of the papers they have mentioned that if you are taking at least 2 cups of coffee every day, it will decrease the chance of having mouth cancer. In the last but not least, the word cancer is mental disease, is the disease of mind, is the disease of imagination, is a disease of mental noise. So please cultivate willpower if you are diagnosed with any type of cancer and fight it with your willpower by changing your lifestyle, eating pattern, and other bad habits. If you modify, you can prolong for many years. With this, I will stop. Thank you very much for watching the lecture.